In light of recent circumstances imposed by the coronavirus disease of 2019, education regarding computer related overuse injuries and ergonomics is more relevant than ever. The purpose of this project is to create a virtual program that educates at risk individuals in ways to prevent the onset of computer related overuse injuries. The contents of the educational presentation were obtained through an extensive literature review of current best practices. All references will be included within the presentation as well as at the end. So, what is ergonomics? Ergonomics is a science that addresses adaptation of the work environment to meet the needs of the individual and the demands of the task. Recent lifestyle changes associated with prolonged computer use and poor posture have made ergonomics an emerging area of study. The goal of an ergonomic program is to reduce the physical strain on the individual without sacrificing performance. Successful ergonomic programs involve education, workplace modification, and integrated rest breaks. Specifically, there are 5 fundamental guidelines when designing a workstation. They include keeping the forces low, keeping postures neutral and natural, providing good visual access, keeping items close, and supporting the body and its limbs when possible. There are many reasons why becoming educated on ergonomics is crucial. To begin, given the existing pandemic, individuals are now being challenged to work from home in spaces that may not be as ergonomically designed as their office workspaces. This may put them at an increased risk for the development of repetitive strain or cumulative trauma injuries. Additionally, literature suggests a prominent association between prolonged static muscle activity with the development of tissue damage, inflammation, or musculoskeletal injury. And the cost of these computer related claims is actually 80% higher than all workers' compensation claims. Unfortunately, if left untreated, the prognosis for these injuries is not promising. They can become chronic, debilitating conditions. Elimination of harmful styles of working through ergonomic intervention has been shown to be extremely effective in controlling cumulative trauma disorders. There are a variety of risk factors associated with computer related injuries. Both posture and hours spent keying were correlated with higher incidence of injury. Specifically, 4 or more hours of computer use can cause injury in women, while 6 or more hours of computer use can cause injury in men. Greater incidence of physical discomfort was also noted when performing typing tasks at an increased speed or force. It's important to note that laptops are not designed for prolonged use due to the positioning of the keyboard and the monitor so close together. Other risk factors related to posture and workplace design include flexing the wrists, bending the neck, working with winged elbows, and more. As we now know, cumulative trauma disorders or repetitive strain injuries are caused by repetition, force, or awkward posture. Common upper extremity conditions associated with prolonged computer use include carpal tunnel, tendinitis, tenosynovitis, or lateral epicondylitis. These conditions are primarily caused by repetitive typing, rapid flexing of the wrists or fingers, or constant gripping of a mouse. Symptoms can range from numbness, tingling, pain, or weakness. The implications of these conditions can be severe as they can impact productivity, performance, and quality of life. There is also added concern of costs of medical procedures and workers' compensation claims. Job redesigning to make the work environment more conducive to task completion can reduce the prevalence of these injuries. To begin, it's important the workspace is large enough to accommodate all necessary items. The height of the table should line up with the armrests. Make sure that you reorganize your desk to keep all commonly used items within reach. Optimal chair design is comprised of 4 different features: the base, the seat pan, the backrest, and the armrest. A chair with a 5-point base is most widely recommended due to its stability. When it comes to the actual seat pan, it's important that it's deeply padded to provide comfort over long periods of time. The front edge should be rounded with at least 3 to 3.5 inches from the knee to avoid compression or restriction of circulation. Adjustable armrests are recommended as this will allow you to rest your forearms comfortably with your shoulders relaxed. Make sure your armrests are not too high or this will cause stiffness and pain at the shoulders and the neck. When typing, it's crucial the wrists remain in neutral. The keyboard should be positioned at the same level as the armrests. The mouse is adjacent to the keyboard on either side at the same height. Optimal positioning of the computer monitor is directly in front at eye level, 18 inches away from the face. It is also important to identify work-related postures contributing to the onset of symptoms. As stated previously, prolonged sitting can contribute to curvature of the spine as well as upper extremity injury. Optimal positioning is achieved when the individual exhibits 90 degrees of flexion at the elbow, hips, knees, and ankles. Proper support for the lumbar region, feet, and arms, as well as maintaining the wrists in neutral, is also recommended. Limiting head rotation and wrist movements can also aid in the prevention of injury. To see what this looks like when it all comes together, I've included a visual created by the University of Michigan Health Services. As you can see, the workstation on the left is designed to allow for proper posture. The armrest is at the same height as the desk, allowing the person to keep their arms close to their body in a neutral position. The feet are flat on the floor with the knees at a 90-degree angle. All commonly used items are within reach. Notice how the chair provides lumbar support as well. On the right, I have included another graphic that displays how poor posture and workplace design can contribute to different deficits. The next slide will discuss some simple modifications that can be made to your workstation. First, it's important to address that the use of laptops for prolonged use is not recommended as they are not ergonomically designed. To modify a laptop, you can simply add a separate monitor or a separate keyboard. This will allow you to keep the monitor at eye level as well as your elbows at 90 degrees by your side to utilize the keyboard. Research regarding the use of specialized keyboards or mouses is conflicting, so it's important to consider that the newest or priciest gadget is not always going to be the best option. When choosing a keyboard or mouse, always remember the optimal position you want to obtain. This has more to do with the positioning of the item than the actual item itself sometimes. Simple modifications you can make to your existing equipment without spending include programming keyboard shortcuts or adjusting the sensitivity of your mouse. Other accessories that are easy to implement include a document holder, a headset, a footrest if your feet do not touch the floor, or palm rests. When using a palm rest, it's important that you avoid any weighted compression to the wrist or palm region, as this can cause further injury. Your wrist should feel supported, not compressed. The utilization of exercise programs to alleviate the symptoms of computer use injuries is widely supported in the literature. Engaging in stretching or exercises has the ability to improve active range of motion, typing speed, grip strength, edema, pain, and more. Multiple studies have also suggested that poor physical fitness is actually a risk factor for the development of repetitive strain injuries. It is important to incorporate a 2 to 5 minute break every 30 to 60 minutes to just move around. This can include stretching or walking. When stretching, always complete the movement slowly and to tolerance. You should feel a subtle tension, but if you feel pain, you are overstretching. The next slides are of simple stretches that can be completed at your desk. Depending on where you feel pain or if you want to prevent the onset of pain to a specific area, these stretches are both simple and effective. The first targets the back. It includes holding your arms straight out in front of you and then raising them above your shoulders. Make sure you sit relaxed, feet on the floor, with your head in neutral. The next neck stretch involves moving your head back and forward, repeating that 3 times, and then another one includes shrugging your shoulders, elevating them, and then lowering them. To really engage the shoulders, make sure to squeeze them together. This really helps relieve the tension with your elbows lifted and away from your body, as seen in the picture on the left. The last stretch is super important for individuals who have to type for long periods of time. It releases tension by clenching and spreading your fingers. Such a simple movement, yet it can be extremely effective. Prevention is possible. The literature illustrates the importance of early detection and prevention as the most optimal strategies in reducing the onset or severity of symptoms. Technical, organizational, and personal interventions can all be implemented to prevent the onset of computer-related injuries. These range from the integration of rest breaks, maintaining an active lifestyle, exercising, workstation redesign, and more. It's important to identify the risk factors or habits that are putting you at risk before they progress to a condition that is difficult to alleviate. Although the Occupational Safety and Health Administration, also known as OSHA, does not have specific standards that apply to workstations, they have a variety of useful resources on their website to identify hazards and solutions. The first link I provided I found particularly useful. It's a checklist that aids in the purchase of different equipment like monitors, keyboards, or chairs for your workspace. It really helps you identify what type of posture you need and what is going to be suitable for you. The next link I provided is it's more in-depth stretching program. I only included a couple of them, but the University of California, Santa Cruz has great stretches included on their website that you can check out. I hope you enjoyed this presentation and found it useful. Please submit the post test using the link provided, and you are all done.